Going to get some afternoon sunshine starting tomorrow and with us every day through Friday, and then also warmer next week. Back to you.
All right, a protest is planned on USC's campus starting tonight at 5:30. Organizers are calling to remove the university's president over his handling of the year's complaints about a campus gynecologist who allegedly sexually abused students. The school now faces a handful of lawsuits and lots of outrage. We'll have more on this developing story coming up at 5. Many young women make their first visit to a gynecologist in college.
Yeah, and with the news out of USC, along with the dozens of young female athletes, well, really hundreds of female athletes victimized by Dr. Larry Nassar, we wanted to talk about what women's rights are at the doctor's office and what to expect at that first appointment. And Alice Benjamin is a clinical nurse specialist with some really important advice for us.
We appreciate you being here with us this afternoon. So the major question is, what should young women look out for when going to the gynecologist for the very first time, like a lot of these women did?
Yeah.
Right. So this is a very overwhelming, frightening, and kind of awkward first appointment. And what I tell women is it's very important that you research your doctor. Of course, making sure they're board certified and all of those things, but you want to do your research to see, what is their scorecard online? What are patients saying about them? What is their practice like? So really do some research and make sure you feel comfortable with them, and make sure that you visit the location. Is it a location where you go into the office, you're warmed, you're welcomed, and that they're providing education? Because the patient-physician relationship is key. You have to feel that you're in a safe environment, that people are explaining things to you step by step by step so you feel safe.
And some women assume that a doctor is doing what is supposed to be done. So how does a woman know when something is really not standard?
Right. Well, many of these women are not health professionals themselves, so they don't know what to expect. So it's important as women that we educate ourselves as to what we should expect at my first gynecological appointment. And where do I get that information? You can actually get it from your doctor. So when you book that first appointment, they should be telling you how to come prepared for your appointment, what you should expect, and explaining to you along the way what's happening, why is it happening, what are you seeing, and why are we doing what we're doing. That way you feel educated in the process. And this should happen well before you're actually in the exam room being touched and examined.
All right, so you're in the exam. You find out that your gynecologist is a male doctor. What should women know going in?
Well, going in, actually, women have a choice. You should be asked if you feel comfortable with a male or a female provider and have that choice. And when you go in, whether your provider is a female or not, or a male, there should be a chaperone. That is the standard of care. There should be a chaperone in there with you, a female chaperone, so you feel comfortable and things are being explained to you. There are certain practices. You should never be getting undressed in front of a physician. You should be provided the gown and some privacy to change clothes. Your provider should be washing their hands and wearing gloves in their assessment, explaining what they're doing before they even touch you, and informing you, saying if anything hurts, you feel uncomfortable, something doesn't make sense, please let me know. I want to explain it to you so you feel comfortable as we're going through this process.
And really quickly, if you don't feel comfortable, you have the right to get up and leave.
Absolutely. The minute you're in pain, uncomfortable, something doesn't feel right, the visit's over. It's over, and you can excuse yourself, and it's okay. So I think a lot of women feel like, oh, I don't want to say anything, I don't want to upset my provider. They actually work for you. So the minute it feels like it's going south, speak up, say something. You're going to protect yourself, and you're going to protect other people behind you should there truly be something going on that shouldn't be.
All right, Dr. Alice, thank you for being with us. We appreciate it.
Thank you.
A lot of good information. All right, coming up new at 5. Drastic times call for drastic measures for one family. Why these parents had to go to court, get their son to move